Okay, this is an interview with Carolyn Olsen on July 11th, 2008 at the Centers for Disease Control and Prevention in Atlanta, Georgia, about her role in the smallpox eradication campaign. The interviewer is Melissa McSwegan. With this interview, we are hoping to capture for future generations the memories of participants and their families involved in eradicating smallpox. This is an incredibly important and historic achievement, and we want to hear about your experience. I have some questions to guide you, but please feel free to recount any special stories or anecdotes that you remember about events or people. The legal agreement you signed says that you are donating the oral history to the U.S. federal government, and it will be in the public domain. For the record, could you please state your full name and that you know you are being recorded?
My name is Carolyn Olsen, and I know I'm being recorded.
Okay, great. Thank you. Okay, so would you please briefly describe your childhood and your education and so on, and what led you into work or participating in public health campaigns?
I grew up in Wyoming, and after doing all my schooling in Cheyenne, Wyoming, I went to the University of Wyoming, where I graduated as civil engineer. And so I was working in Los Angeles when I met Dennis, and shortly after we were married, we went to Africa, and we enjoyed our 3 years in Liberia. Then we came back, and again I worked as an engineer, and we were in Springfield, Illinois when he went to Bhagalpur for 3 months, and during that time I was working for the Environmental Protection Agency and also getting my master's degree in environmental engineering. So when he went to India, I said, I can't go right now, I have to finish my master's degree. So he sold the house out from under me, and so I house sat that summer while I finished my degree, but he knew I was coming to India because I didn't have any place to live. And so I finished my master's degree, and then I arrived in India, and he met me in Delhi, and it was pretty bad. And so after 2 days, he put me on a train, and we went off to Lucknow, and he said, I didn't decorate the apartment because I thought you could do it. And I sat there, and all the wire was on the outside, the refrigerator was in the living room. It was really basic, and I thought, oh my goodness. And so he said, I've got to go to work now. And when he came back, he said, I've got to go to the field tomorrow. Do you want to go? So we went off for a 10-day field trip, and when you go on a field trip, you stay in very interesting places. Probably the best items that we took to India were our sleeping bags, and because we would stay in, they call them dock bungalows. And they were usually about 15 cents for a place to stay and breakfast, and it wasn't worth it.
Oh, really?
They were really very basic, and if we had water, if we had hot water, we were very lucky, but usually we had water on that. But then when we came back from that first trip, Lucknow looked great. And then about a couple weeks later, I used to have to fly or take the train into Delhi to get supplies. And like Dennis said, it was like going to Europe. I mean, Delhi looked first class after being in the field.
Your perspective changed
Yes.
quite a bit during
Yes.
that time. How did you mentioned that you went on field visits with your husband when he was working with the smallpox campaign. Did you play any particular role during these trips?
Well, many of the villages were very rural, and so I would usually walk along, and because many times by having a woman with them, the women were more comfortable. But also I found it was very interesting. Sometimes they have folk art, just different things in the village. I'll tell you one of the most interesting days. So in India, women always have their legs covered and usually their arms. And so I used to wear Levi's and a kurta, and I had very long blonde hair at that time and often wore it in a pigtail or pulled back. And on one occasion, we came to this village way out in the middle of nowhere, and I was reading a book that was really interesting. So I said, I'm not going into the village, I'll just stay here in the Jeep. And so all the children come and they looked at me, and then they all ran away. And then all the ladies came, and they got in a nice little line, and usually people will go namaste. But if you're very important, it's namaskar. And the ladies were all giving me the namaskar, and then they would chat away in Hindi. Well, the driver was just howling. I mean, he was over by just holding the sides. The children had told the women that Indira Gandhi had come to the village. So they were all telling me and all the men were in the field because they were farmers. And so probably in some village in India, there is a myth of the day that Indira Gandhi came to visit on that. But in general, we would always go to the different health units, and many times the Indian doctor was somebody who was either trained in Delhi or Bombay or now called Mumbai, and they were so glad to see somebody who spoke English. I mean, they would get out their wedding pictures. These poor young ladies had arranged marriages, and now they're in a village, and they were used to living in a big city. And so oftentimes we had dinner with them. I mean, they were very hospitable. And we just had a very interesting time in our field visits. Again, we would go to many different health units during a day, tracking down things and making sure their records were right. And the sanitary facilities, again, being an environmental engineer, were not always that great. And so you always had to watch your intake during the day. And so everybody wanted to give you tea. And I didn't know at first how to say no. And then I found out that, again, it was Rajendra Singh, our Dennis's PMA, who told me, well, tell him you're fasting. So I would say, oh, thank you, but I'm fasting today. And they would say, why? And I said, oh, I'm fasting for the health of my husband and the success of the smallpox program. And they would think I was just this wonderful person. And then, you know, 2 health units further, I'd have a cup of tea again. You know. But again, you were in an environment that was very different than what most people, especially during the hot months. It was like 120 degrees, and you couldn't roll down the windows in the Jeep because the wind coming through. And one day our driver took a shortcut, so we got lost, and we ended up stopping in a village where they went in, took the straw out, and got us a piece of ice out of the ground, which we put in a bucket, and bought about 24 Coca-Cola, and we would get towels wet, put them on our head, and it was just an interesting day. I mean, very trying on that.
Did you have the opportunity to apply your engineering background and engineering training while you were living there?
Not really. Again, sometimes there would be water questions, and but it really didn't lend itself to get involved. I was able to do that more when I was in Liberia. I taught sanitation workers how to do mapping and different things. But again, we were moving quite a bit when we were in India on that.
Describe a bit your relationship with the host country counterparts or the people you were interacting with on a day-to-day basis. How did that work?
Being a woman in India is different. Our living arrangement was quite nice in that we lived upstairs in what's called Bersati of the Dosses, and Mrs. Doss was actually the president of the girls' school next door, Isabel Thornburg College, which is a prestigious college for Lucknow. And Mr. Doss had been the police chief for the whole state. And so we were included in that part. So there I felt very comfortable being a woman. But when we were in the field, it was, or when you were alone, you always felt like, especially young boys between like 15 and 23, they were very aggressive. And so you would always like to make sure that you were, and as a result, you know, the the PMA and the driver and everybody were always very protective of me. And being a professional person, I was not used to having to kind of being protected. And then later on, when we moved to Delhi, it was a matter of having the taxi driver watch you while you went into the market. And it wasn't that you felt security. I mean, it was just that they wanted to touch your hair or something. One time, I was having this strange pain, and my fingers were starting to go numb. And so I went to a doctor in Delhi, and they said that I had hobo's disease. It was my arm, from riding in the Jeep, I would have my arm up, and it was pinching a nerve. And he says, but I think we should x-ray you. So I went in, and the doctor came in, and he started laughing because the paramedic had put my hair, my blonde hair, so it was like a halo. And while I was laying there, and but in general, you know, you just go with the flow of things. It was quite interesting on that.
What were some of the biggest challenges to living in India?
Food actually was kind of a challenge. When we were in the fields, we were usually vegetarians because you didn't know the last time somebody who may have come through and eaten meat, so you didn't know how old the meat that was in the restaurant or on. And we ate at the truck stops along the way, and so we would always have to ask them to put the samosas back in, or put new samosas into the hot oil, so everything we ate was hot. Rare, you know, the embassy doctor used to just be amazed because we would not get ill, but we didn't eat fresh vegetables unless we were home and they were peeled. And even if we went to a very nice hotel or a nice buffet, and we had a lot of soup and a lot of things. But also, we had a cook. He had a reputation. He had worked for Dr. Francis and Dr. McGinnis, and everybody knew that Edu was just a wonderful cook. And so Edu was an old man. I mean, now he was probably 40, but anyway, he seemed like an old man to us at that time. And he became ill, and they gave him streptomycin, which caused inner ear damage. And so he was having a hard time walking, and so then I would pay for a rickshaw to bring him right up to the door, and then I had him bring his daughter, who had had smallpox, so it was really quite appropriate. She was blind in one eye and had pox, to help him so he could do his work. And one day, and she would do the marketing, he would do the cooking, and most of the time. One day I am cooking, he is sitting there with his feet up, she is outside drinking tea, and I'm thinking, and I have servants, you know. But during that same period of time, then Edu got ill or more sick, and so about every 6 weeks or so, we would have this regional meeting, and all of the epidemiologists would come in, and the international epidemiologists would come for lunch, and then the Indian and the international ones would all come for dinner, which would be about 100 people. And so we'd have usually about 12 to 15 for lunch. And I had Sabra, who could help, but Edu was gone, so it was up to me. So I thought, well, what? So for lunch, we had peanut butter and jelly sandwiches and Kool-Aid for the international group. And then for the other people, I did manage to find some things that were almost ready-made. You add 2 vegetables and you became, you know, and I thought, okay, this is adequate. Well, the next month, as we're going around to the different epidemiologists to see how things were going and everything, all the international ones says, boy, I hope you have that same lunch next time we're here. That was the best thing. I'd go to bed at night dreaming of that peanut butter and jelly sandwich, you know. And then the Indian doctors, and Indian doctors actually had a harder time finding food because their wives had taken care of their food in their houses. and rarely did they eat out. And in India, you have to sort your rice and, you know, all those different things. Well, a couple of them asked for my recipe for the different curries I had made that night, and I didn't have the heart to tell them that I had gone to the store and bought a box of something that I put in it, you know. So I kept telling them, well, I don't, you know, really know the recipe, you know. But I had an enjoyable time. It was a challenge, and you never quite knew what the day was going to bring.
Were you able at some point to decorate your apartment? You had mentioned the apartment had all the wires on the outside, and did it eventually become
actually
more?
started looking pretty good.
Okay.
I mean, you had fluorescent lights, you know, I mean, definitely. But during the, well, electricity was not always available. And so sometimes, I mean, you would have company or somebody, and all of a sudden all the power would go out, you know. And before the game Trivia Pursuit, we used to play a game that you would give the person the almanac and the flashlight, and they would ask the other people questions. And so that was our entertainment on that. But when we were in the field, sometimes if you didn't have power, we would go to the movie, because the Hindi movies are 4 hours long. They usually have fans, or if they're upscale, they have air conditioning, and they have their own generators. So we used to go to a lot of Hindi movies when we were traveling. And it was, like I said, the heat was a challenge when you have 120 degrees. Then the cold was a challenge because you had 15-foot ceilings and no heat. And so if you invited people over for dinner, you would put the heater under the table, and everybody would sit there in their coats, and you would usually have, you know, kind of soup or something hot. But other than that, I mean, it was probably the most growing experience I have. I mean, if you look at going to school, going to college, going to India is just straight up. I mean, it's like they say, you see the poorest, you see the richest, you are the hottest, you are the coldest. Everything is a dichotomy. And the people there, were just absolutely very hospitable and very, very, very nice. I mean, they were a bit, you know, again, I would say kind of shy. But some of the doctors that we met, especially the Indian doctors that were in charge of different areas, were very, very nice. And this apartment that we had, since they would come to visit us, they would see what we lived in, so then they felt like they could invite us to their home. Or so whenever we went to Delhi, we would be invited to some of the doctors' houses. And probably one of the best invitations we ever had was Dr. Harkoli while we were there, they had the Kumbh Mela in Allahabad, which happens, I think, every 15 years. And it's on the riverbanks of the Ganges. And on a busy day, about probably 10 to 15 million people come. And we were invited to come and stay in one of the tents for a minor bathing day, so there was only about 5 million people there. And so the Jumna, the Sagma, and the Ganges all meet there, and everybody goes to bathe, and they have the parade of the sadhus. And the first night we arrived, there was this chanting, and so I asked Mrs. Harkoli, I said, do they pray all night? Because it sounded like the Hare Krishna chant. And she said, pray? I said, yes. And she said, oh, no, they're listing the hundreds of women who were lost today. And it was a tradition that when you went back to your village, you stopped at Lost and Found to see if anybody from your village had come and gotten lost, to take them back. And you would see these ladies with their saris tied together, and some young, son taking all their aunties to this festival. So it was very, very interesting.
What were some of the biggest differences between India and Liberia in comparing your two experiences?
Well, I worked in Liberia, so I was working as a school teacher there and teaching math. And in India, I felt like my role was more to support my husband, and then there were a lot of social functions that, you know, like when the international group came, again, we hosted at our house. When we lived in Delhi, and probably, well, the type of people we met in India were very different even from the international side, because the Soviet Union was also had provided quite a few epidemiologists and doctors for the program. And so we not only had Russians, but we also had people from Czechoslovakia and a lot of the Eastern European countries. And it was an education in social mores, and also in how different countries looked at the Soviet Union, and how when they socialized and when we socialized, it was very different, because like if we were to go to a party that was put on by Dr. Kodakevich or something, as opposed to when we had a party, we would look around and find out who else had a servant who could be the bartender and somebody else. So we had all Indian staff working the party. When we went to a Soviet party, it was people from the embassy. I mean, there were all kinds of ladies and other people that were Russian that were, and you know, you weren't uncomfortable, but you knew it was very, very different.
Mm-hmm. How did your time abroad, particularly in India and Liberia with the smallpox program, how did that affect your career and your life afterwards?
Well, on a, I guess, a personal, India is such, I mean, it's just, there's so much energy and so much to do and so much to see that I just suddenly felt like I either had to write a book or do something, and instead I started painting, and in about 6 months I painted 60-some pictures, all Indian. And in India you can do anything, so I had a one-woman show and sold my paintings, and it was quite interesting. And one of the highlights was that Dr. Sencer actually purchased the first painting I ever painted, which was of a train station, and gave it to Dr. Faggy. And so my claim to fame was that one of my paintings was in the Carter Center for a while. And but on a professional side, it really brought home the need for clean water. And my profession, as it moved forward, I was Commissioner of Water and Pollution Control for the City of Atlanta, and I was very involved in a lot of water and wastewater activities. I also then became the president of a nonprofit which is called Water for People, and it gives you a real empathy for how important clean water and drinking water is, because when we were in the field, in order to have clean water, we used to carry, they're the old milk buckets that are kind of made out of aluminum that are about this tall, and each night we would fill our jug up with water, put the immersion heater in, boil our water, and put it in a, you know, so we never had cold water, but we had clean water. And with all the disease and the different things, you just realize that water is probably one of the most important parts of our existence. Yeah.
Well, do you have any other stories or anecdotes that you would like to share with us? Any memorable moments from your time there?
Oh, I must say that when we moved to Delhi, I didn't get to go in the field anymore, so I became a professional traveler. And as a result, anybody going anywhere, I would go. And I was able to go up to an area close to the Nepali border, which was called Tiger Haven, where they would bring small tigers back from London and get them back into the wild. And they would put you up in a cage and let you watch the animals, which was very interesting. Another time I went with some missionaries, and we took a train ride on no-class train, and it was a 24-hour ride down to near Bombay, and I went with some Swedish people, and it was a very, very interesting, because we used to travel on by train, but we used to travel at least you know, first class something, which wasn't that great, but this was, I think it cost me $10 to take a 24-hour trip, one return, you know. And on one train, we were in a car, and the rest was freight, and all of a sudden, there was a band, and it came through playing, and it then got off the train. Well, come to find out, they were on top, and that's where they would make tea, and they would lean down over and sell you tea into the compartment, but they were riding up on top. And the last trip that I took that was very interesting was some people from the embassy were going to go from Delhi to Kabul, Afghanistan. So we went through Pakistan and through the Khyber Pass and into Afghanistan. And that was all in the 70s, so that was before the Russians came. And I just feel very sad when I see what has happened to Afghanistan. And I don't know if you've read it or not, but Kite Runner, when it was described at the beginning, is the kind of Afghanistan that I had seen. And I also had empathy for Afghanistan because when I went to the University of Wyoming, the University of Afghanistan and University of Wyoming were sister colleges, so I had met Afghans then also. But other than being the world traveler, I think that was pretty much a very positive experience, and again, I'm sure it changed my life. I mean, it just gave me a whole different way of looking at the world, and you know, from a Southeast Asia standpoint, but also with all the different cultures that we met through the program.
Okay, well, thank you for sharing your story.
Okay.